This is Tom Bernanke, and these are the foods you need to avoid to help your kidneys and help reverse the damage done to them. And we're starting now. I know as a foot doctor, I'm probably not the #1 person to be getting your kidney info from. What people don't realize is we see thousands of patients every year with swollen feet, swollen ankles, peripheral neuropathy, ulcers, and one of the #1 contributors for that is kidney disease. So especially in the early stages of kidney disease, I see a lot of these patients. I make sure to get the workups, get people to seeing their proper nephrologists and their doctors. Kidney disease is so common. 840 million people in 2017 worldwide had it. That's 1 in 10 people, and most don't even know it. Look at how much it's increasing. It's one of the most common and the most expensive diseases out there. So make sure you get checked out if you think you might have it. Right now, I'm doing a deep dive for my patients and myself. What can be done about kidney disease? How can you help your kidneys? And these foods are very important to help people with their kidneys because a lot of the times this can be improved. There are small changes you can make to turn your entire life around. And I see that with my patients with kidney disease that come in. Sometimes these symptoms can just sneak up on you, but dry, itchy skin, being tired, bubbly or foamy pee, more swelling in the foot, hands, puffy eyes, trouble sleeping, loss of appetite, muscle cramps, the need to pee more often. These, I almost feel guilty saying these because I experience all of these symptoms. And check out these skin changes: paleness, skin discoloration, hyperpigmentation, petechiae if you have like little red blood vessels underneath your pale skin surface, scratch marks that are not healing. Dry skin, that's something you see a lot, kind of the ashy, dry skin. Your kidneys perform very important functions, including filtering your blood, removing waste through the urine, producing hormones, balancing minerals, maintaining fluid balance. When your kidneys become damaged and cannot function properly, fluid can build up in your body and waste can accumulate in your blood. You feel fatigued, tired, toxins build up, you get conditions like gout, and this creates further damage to your body. So to be clear, this is not for kidney stones. That's a separate video. This is for chronic kidney disease that's associated with aging, with diabetes, with heart disease, with vascular disease. Over time, as our kidneys slow down, this is what these are foods for. Common causes in the United States, and #1 is diabetes. Diabetes rates are rising every day. To me, these rates are crazy. Pakistan, Egypt, Qatar, Malaysia, Saudi Arabia, the Middle East, Mexico, extremely high diabetes rate. The US is actually number 55 in terms of population. Right around there is China. And believe it or not, China actually has the most overall diabetics in the world now. And after COVID, the pre-diabetes rate is rising. So China and India make up the vast majority of diabetics worldwide. And it's increasing rapidly. Doing everything you can to control your diabetes, getting your blood sugar down, correcting your diet, losing weight, that's one of the best things you can do to lower your blood sugar rate and to improve your kidneys. In the early stages, there can be progress made for sure. #2, high blood pressure. High blood pressure can strain the blood vessels and the kidneys, leading to chronic kidney damage. This is a very common cause and #2 behind diabetes. Alcohol consumption, frequent urinary infections, smoking, side effects from certain medications, anti-inflammatories are very common, and there are other genetic actions and other toxicities. Glomerulonephritis. This is an inflammatory condition which can damage the kidney. Then there's also polycystic kidney disease. There's kidney infections. There's urinary tract obstructions, and certain medications can irritate them. Most famously, the anti-inflammatory drugs, non-steroidal drugs, antibiotics, and blood pressure medications. There's also autoimmune disorders and genetics. And a big one is alcohol consumption or older age. Some diets that you can do is cutting out your alcohol, cutting out smoking, getting as healthy as possible. How are dietary restrictions for kidney disease determined? Your specific dietary restrictions will depend on the stage of your kidney disease. Different stages have different recommendations. So like a stage 1, early kidney disease will have much different recommendations than end-stage kidney failure. Those with end-stage kidney disease do need dialysis, and they need to have their water filtered out of their body and their waste. At this point, you do want to work with your doctor. It's a little bit more of an advanced situation, but generally these principles should still hold true. at the beginning. Most people don't even know they have it. But remember, this is 1/10 of the world that's experiencing it. So with the early symptoms, it's generic stuff like swelling in your feet, in your toes, you're a little bit tired, you just have to pee a little bit more, but your kidneys are still working at 60 to 89%. But then stage 3, you might start getting gout, you might start getting some more swelling, you might be getting more of these symptoms that we talked about. And then stage 4, failure is imminent. You're already down to 15 to 29% of your original kidney function. And then when you get down to 15% or less, that is end stage kidney failure. That's when you start having significant problems and you need dialysis. That's when your life really changes, unfortunately. And those with chronic kidney disease, that means your body cannot adequately remove sodium, potassium, phosphorus. As a result, they're at a higher risk of elevated blood levels of these. A kidney-friendly diet or a renal diet focuses on limiting things like sodium. So you want to keep it under about 2.3 grams per day or 2,300 milligrams, as well as limiting your potassium and your phosphorus, and as well your protein levels. You don't want to overload your kidneys all at once. The National Kidney Foundation does not set specific numbers on a lot of these, but it is smart to look at the studies and know that they should be kept low. Damaged kidneys may also have trouble filtering waste products and protein metabolism. Thus, especially stages 3 through 5 should limit the amount of protein in their diets unless they're on dialysis. Then your dialysis will take care of it. But you have to remember, you can't just stop eating protein because almost all of us are short on protein at the same time, and you don't want your muscles to get weak. So it's a balancing act. If you have kidney disease, you may also follow a special diet low in sodium, phosphorus, potassium. And while this may not always heal your kidney, there's a good chance that it can improve the function. And as your body weight gets down, you get healthier, you will function way better. Here's the list of the top 18 foods. Number 1, soda. This is filled with high fructose corn syrup and dark color sodas as well. The dark color harbors phosphorus, which can be damaging to your kidneys. The high fructose corn syrup, it gets converted to fat in your liver, in your body. It puts more stress on your kidneys. This is the number 1 thing you could remove. So sodas, juices with high fructose corn syrup, that added phosphorus in soda, it's not good for you. You don't want that additive. It's bad for your kidneys. So if you drink soda every day, get rid of it. There's a lot of studies on the phosphorus in sodas. A 12-ounce bottle can have 34 milligrams of phosphorus. As a result, this is an easy number 1. Get rid of this in your diet. Stop drinking soda. It will change your life. Not just because of the high fructose corn syrup, but because of the phosphorus as well, which is harmful to your kidneys. Number 2, avocados. I love avocados. They have a lot of heart-healthy fat, fiber, and antioxidants. But the problem is they have a high amount of sodium. So if you're in stages 3, 4, or 5 of kidney disease, you probably want to limit going crazy on the avocados. In fact, one avocado has 690 milligrams of potassium. But if you're in like stage 1 or you don't have kidney disease, avocado is great for you, and that potassium could actually help with blood pressure. By reducing the portion, that could be good enough. Just keep an eye. You want to keep that potassium to a reasonable amount. So eating 2 or 3 avocados might be too much. While an avocado is super healthy normally, be aware of the high potassium that is tough on your kidneys. Number 3, canned foods. So soups, vegetables, beans. These are low cost. They're usually easy to eat. They're easy to preserve, but they're very high in salt. Remember, people with kidney disease do best with less than 2,000 milligrams of sodium. Look on the side of those cans. They are loaded with sodium. It's like half your day's value. Number 4, whole wheat bread. Choosing the right bread could be confusing. What kind of bread? Dark bread is usually great for its high fiber content, but the problem is it's high in phosphorus, high in potassium. These are hard on your kidney. You want to give your kidney a chance. You don't want it overworked. A slice of bread, for example, could have 90 milligrams of potassium. So you eat a few slices of bread, that's like half your day's limit of phosphorus and potassium. Cutting out breads will limit the amount of sugar you're getting in your diet anyway. It'll make you healthier. So cut the breads out as well. Lower phosphorus, lower potassium levels. Number 5, brown rice. Brown rice is better than white rice in most circumstances, but the potassium and phosphorus content is higher than in white rice. 1 cup of brown rice has about 150 milligrams of phosphorus and 95 milligrams of potassium. You might want to go with something else. Realistically, get a new base. I go over different bases that you can put in my kidney repair diet, which is the opposite of this video. Check that out once you're done this one. Consider bulgur, buckwheat, pearled barley as nutritious lower phosphorus grains that can make a good substitute for brown rice. So because of the phosphorus and potassium, avoid brown rice. Number 6, bananas. I love bananas. Normally they're super healthy, but with kidney disease, you have to be aware of the high potassium content. And 1 medium banana can be almost 450 milligrams of potassium. This is really high potassium levels, which are normally good for blood pressure, but for kidneys, not the greatest if you're stage 3, 4, or 5. Pineapples can be a great option for fruit without the potassium, for example. Number 7, dairy. Dairy products are great in vitamins and nutrients. I have a video, the top 10 lies and all the new studies on dairy. Check that out. It's actually really good for you in most cases. It's for most people, not all people. Kidney disease is one of those people because of the high phosphorus and potassium. A cup of milk has 322 milligrams of potassium. It's hard on your kidneys. There's some phosphorus there. So maybe limit your milk. You can drink a glass, but you don't want to drink much more. Dairy is also high in protein, which is normally good, but you just want to keep an eye on these levels. Phosphorus, potassium, and protein. It's high in milk and normally good for you. It's good for your bones, but you don't want it with kidney disease, or at least you want to keep an eye on it. Number 8, oranges and orange juice. These are loaded with high fructose corn syrup, and while they do have vitamin C as a nutrient, it does have high potassium in this juice. The reality is, juices suck. They're filled with high fructose corn syrup. They don't tell your brain that you're full. You keep drinking potassium. There's some nutrition in it, but the reality is just eating orange instead is 100 times healthier. You could try the actual fruits themselves, like grapes, apples, cranberries instead. Number 9, processed meats. I would say this, processed meats have been given a bad rap. I'm not saying to go with them because they're generally cheaper. Be aware that they're salted, dried, cured. They're high in salt in a lot of cases, and you want to limit your sodium levels. The fact that they don't have sugar is good for you, but you don't want that salt, and you don't want to overload your body with too huge amounts of protein. Number 10, pickles, olives, and relish. These are normally great. They're usually cured. This is a large amount of salt and it's hard on your kidneys. So for example, 1 pickle can have like 500 milligrams of sodium or more. Same with sweet pickle relish. Same with olives. They can be very salty, especially for storage. The more you want to store them, the more salt they're going to have. Pickles, olives, and relish, usually high in sodium. Number 11, apricots. These are rich in vitamin C, A, and fiber, but they're also high in potassium. It's very sad because all these normally great foods are high in potassium and they can be hard on the kidneys. Just 1 cup of apricots can be 1,500 milligrams of potassium. That's more than you want to take. This means just 1 cup can give you 75% of your 2,000 milligram potassium hard cap restriction. It's best to avoid these apricots until your kidneys get better, if they do get better. Number 12, potatoes and sweet potatoes. These are potassium-rich vegetables, normally an okay option, but 550 milligrams of potassium in some of these potato portions. Just be aware that boiling it can decrease it. It leaches out in the water, but 5 to 10 minutes only decreases it by 20%. This is called potato leaching. It does leach some nutrients while you're boiling it, but the reality is you just want to be aware there's a lot of potassium in sweet potatoes and potatoes. Number 13, tomatoes. Tomatoes are another high potassium fruit that may not fit the guidelines of a renal diet. They can be served raw or stewed and are often used to make sauces. Just 1 cup of tomato sauce can contain almost 800 milligrams of potassium. These are commonly used in many dishes. Several substitutes are available. I love tomatoes normally, but they're high potassium. You got to keep an eye on it for that 2,000 milligram cap. 14, packaged, instant, and pre-made meals. These are usually high in salt, especially frozen, microwavable, instant noodles. Be aware, 2,300 milligrams per day may be difficult, If you're eating these, you're going to shoot way past that. That puts a lot of stress on your kidneys. Anything processed, anything that sits on a shelf will have a lot of high fructose corn syrup or salt. Anything packaged that you heat up in the microwave or the oven, just be aware of it. 15, Swiss chard, spinach, and beet greens. These are leafy green vegetables with high amounts of nutrients, minerals, including potassium. These are normally so healthy for you, maybe even like stage 1 or 2. They're great for you, but once you're in the later stages, you want to limit that potassium. And all of these have a high amount of potassium. For example, raw spinach can significantly shrink. When you cook these, it takes a lot of that potassium out of there, but maybe like 50%. It's still something to keep an eye on. And also for kidney stones, it does contain oxalates and can put you at risk. These kidney stones may further damage your kidney tissue and decrease kidney function. Leafy green vegetables like Swiss chard, spinach, beet greens are normally superfoods that are amazing, but they can cause kidney stones and overload your kidneys with potassium. Number 16, dates, raisins, and prunes. These are common dried fruits. Their nutrients are concentrated, especially potassium. For example, 1 cup of prunes provides 1,270 milligrams of potassium, which is nearly 5 times the amount of potassium found in 1 cup of plums. Given the high amount of potassium in these common dried fruits, it's best to go without them while on a renal diet to ensure your potassium levels remain favorable. These nutrients are concentrated when fruits are dried, therefore potassium content of dried fruit, including dates, prunes, and raisins, is extremely high, and you have to be careful on a renal diet. Number 17, pretzels, chips, and crackers. Ready-to-eat snacks like pretzels, chips, and crackers, anything that can sit on your shelf for a long time, is pretty high in salt. So it's important that we also eat way more than our portion size. That salt intake is really going to overload your kidneys. And the fact that chips are made from potatoes means you're also getting potassium. So salt and potassium is hard on your kidneys. And then number 1, boom, the worst, high fructose corn syrup and high sugar foods. Diabetes is by far the number 1 risk factor for chronic kidney disease. High fructose corn syrup is so cheap to make, it's injected in all of our foods. There's so many bad foods, like anything processed, like candies, cookies, anything that sits on a shelf, any added sugar. Diabetes is by far the number 1 risk of chronic kidney disease. If you can fix your diabetes, which for a lot of people, improving the symptoms is definitely possible. I don't know where this crazy theory comes from that you can't reverse diabetes. I'm not talking about type 1 diabetes, because that's only 10%. Yes, that is a different story. But type 2 or obesity-related diabetes due to high fructose corn syrup, you can improve this. By helping your diabetes, it takes so much strain off your kidneys, it stops it from getting worse. So even if it doesn't reverse it, it stops it from getting worse. It saves your health. You have to do something about your diabetes. Kidney disease is a brutal, tortuous process. Don't get to the point of being on dialysis. And if you think you might have kidney disease, get checked out. Get your lab levels monitored. I have a video that goes over how to diagnose your kidney disease. Make sure to check that out. Here's the big secrets of kidney disease. Is it reversible? It's improvable. So you can improve your situation a lot. Is anything in this world reversible? We can't reverse old age. So from that standpoint, nothing's reversible, but things can be improved. An obese diabetic person can lose weight, get fit, build muscle, get jacked, and you can do it too. The fact that you can't do 100% improvement and become a healthy teenager again doesn't mean you can't improve your life like 90% or more. I see that all the time with my patients, so that's my pep talk to you. I believe in you guys. You, the audience, are so amazing, and I love you guys so much. I want you to be successful. You can turn your life around and make that decision today. What foods help the kidneys work better? The best thing you can do to help your kidneys is to eat a well-balanced diet of nutritious, vitamin-rich foods that are low in sodium, potassium, and phosphorus. And I include that guide below. But things like cheeses are a good option. Milk alternatives like oat, soy, or rice milk. Healthy cooking oils such as olive oil, extra virgin olive oil. Fish like salmon, you get that omega-3 fatty acid as long as you don't go crazy eating way too much protein. But fresh fruit can be good, like strawberries, blueberries, Berries with antioxidants are good. Apples, pomegranates, beans can be very good. Tofu can be really good. Cheeses like grated Parmesan, mozzarella, Monterey, Swiss cheese, brie cheese, they're all usually okay. Is peanut butter good for the kidneys? Peanut butter is a good source of plant protein. It's naturally low in carbohydrates. It's low in carbs. It has plenty of fiber, and it's a good substitute for meat in a kidney diet plan. At Costco, I like the powdered peanut butter. That's a great option for me, lower in calories. Just be aware that there are oxalates if you eat too much peanuts, and this can contribute to kidney stones. So if you're prone to kidney stones, that can make your kidney problems worse. So just don't go crazy with that peanut butter. And take a look at the brand. Make sure there's no extra salt or sugar added to the peanut butter. Is chocolate bad for the kidneys? Dark chocolate is rich in antioxidants and has actually been shown to reduce inflammation in people undergoing dialysis. Yes, that's a real study. But it is high in calories, and added sugar containing phosphorus and potassium can lead to too much overload if you go crazy. You want to keep it in moderation and you're good. Are eggs good or bad for the kidneys? Eggs are highly nutritious and can fit into a balanced renal diet. However, if you have a protein restriction, be aware, but the reality is there's no reason eggs can't help you. I've heard so many good stories with eggs and even with people with kidney disease. Just be aware, don't go crazy like eating like 24 eggs in a day. Is coffee bad for kidneys? Enjoying the occasional cup of coffee is typically fine on a renal diet and is unlikely to affect the kidney health. However, drinking more than 4 cups and adding milk, creamer, or flavored syrup can add potassium, phosphorus, so just be aware. Kidneys are intricate organs with millions of nephrons, and kidney damage is often caused by chronic conditions like diabetes, high blood pressure, vascular disease, and not a specific food. The key is controlling these specific conditions. Chronic kidney disease can result from a variety of factors, and the most common include diabetes. This is by far the leading cause, and diabetes rates are going sky high. As a foot doctor, I see so many diabetic patients and kidney disease patients. This is the number one thing you can do. If you can control your diabetes and get your blood sugar down, that is huge. The bottom line is, if you have kidney disease, limit your potassium, your phosphorus, your sodium, and this can be an important aspect of managing kidney disease. A lot of the times, if your health improves, your kidneys don't have to work as hard. And sometimes the body's an impressive thing. It can improve. So earlier stages of kidney disease can improve too. Certain types of kidney stages can improve. Certain types of diseases can improve. It all depends on you and the doctor evaluating you as well. Following a renal diet is tough, but you can do it. I believe in you guys. Check out my related videos on all that below.